I think it's actually gotten here. We had a beautiful spring day here in the Northeast, in the Boston area, and I'm loving it, and I'm saying bring that heat, bring it. It feels like it's been so long since we've actually been able to turn the heat off and enjoy the sunny day. I'm looking out the window right now, and it's still light out. It's 7 o'clock our time, so it's really exciting, and I really feel like we're starting to turn the corner when it comes to weather. Welcome to Ask the Aesthetic Mentor, as you all know. Hello, Seaport. As you all know, I am Dr. Russo, the Aesthetic Mentor, and I'm here to help you navigate your journey through this minefield we call aesthetic medicine. And hopefully I'm helping. Hello, Val, one of my loyal followers. Thank you for joining. If any of you want to train with us or take some of our courses or join us in Cadaver, go to the link in our bio. We have a campus in Waltham, Massachusetts, and one in Glastonbury, Massachusetts. And we'd love to work with you and love to train you. We always have a lot of fun, and it's really great learning. And I think we were totaling it up the other day, and we've trained over 5,000 students right now. The vast majority are RNs, but certainly we've had our fair share. Hello, great to see you as well. Certainly we've had our fair share of physicians and NPs and PAs and estheticians, starting a whole different track for them. But primarily RNs, so welcome aboard. Let's start this aesthetic journey together, or at least continue it, right? We started a long time ago. Couple things tonight. I know we were going to talk about dealing with a difficult patient who has high expectations and all that kind of stuff, and we will, but I don't know, there's a couple other things I think you guys are really interested in, some really sort of interesting clinical information everyone loves to hear about. I don't mean loves to hear it in a, like you're happy that someone's had a bad result, but hearing about complications, problems, issues, because that's something that we all struggle with. It's something we all have to be able to deal with, and that's something we're all going to have to face, right? If you do enough of these procedures, it's simply a numbers game, right? It's you do enough of these procedures, you're going to have a problem. And one of the old adages in surgery is if you're not having complications, you're either lying or you just haven't done enough yet, right? So if you do enough, you'll see problems and complications, and you need to know how to deal with them, right? If you don't know how to deal with the conversations, Robert Blake used to say, who was an old actor who ended up in jail, don't do the crime if you can't do the time, right? He ended up, I think, killing somebody and, going to jail. So I guess he felt like he could do the time. But if you aren't able to handle complications in surgery, we always say, that's really a recipe for disaster, because, everyone will have them, but dealing with them well, separates you from everyone else. And if you can't do it, don't do the procedure. And the same thing holds true with neurotoxins and fillers and all the procedures that we're going to talk about. I'm going to talk about laser today, because I saw a problem, a complication from a laser patient today. Patient was treated with an erbium laser about 4 days ago, and had the face treated, had the décolleté treated, which always scares me. So the patient was treated with relatively low settings, nothing dramatic, nothing, hello Mac, nothing excessive, certainly not. And the patient said really never had any significant pain in her face, things healed well, but about day 1.5, right before the end of day 1 into day 2, she started having just tremendous pain in her décolleté. And she said, interesting words, I'll file this away and I'll come back to it and you'll understand why I'm asking you to file it away now. She said, I felt like I was burning from the inside out. Right? Obviously the laser was all external. But I thought that was, hello, Jules. I thought that was a very interesting description. So, as with all of these patients who have complications and issues and questions, it's really the history that helps you the most. And you have to be a diligent historian. You have to ask questions to really help you understand, because sometimes people just, I don't want to say they're hiding information, but they don't give you information because you haven't asked them for it, right? We had a patient recently that had an occlusion, and she was asked if she was having any pain. And she thought the nurse was asking about a different area, so she said no. And then the next day we said, well, why didn't you say yes, you were having pain when it was already ischemic? She's like, oh, I thought she was asking about a different area. You know what I mean? So, sometimes people aren't trying to mislead you. They just aren't understanding the questions, or you're not being clear enough. So be a really good historian. Extract as much information as you can to try to get as clear a picture. So understand, start at the very beginning, understand every step of the way, everything that was done, every product that was used, what they did after that, what time it happened, what else was going on. Just get as comprehensive a picture as you can, because you'll be surprised. You'll hear a little detail and you're like, you put something on your skin after we told you not to, and you use what product? So it really helps. But in this particular case, the patient felt like her face healed really differently than her chest, and her chest was in excruciating pain. She couldn't even put a blouse on or a shirt or anything on her chest. She had to sort of walk around without anything on, and it was so different than her face that she understood something was wrong. The nurse who performed the treatment, is an excellent nurse, and used low settings and did a good job on the face, but clearly something different happened in the chest. What happened, right? What's different between your face and your décolleté? Let's say right in this area. Now, in women, right, this is also a very thin area. Waving at a lot of folks tonight. Very nice engagement. Thank you all for joining, spending some of your Tuesday night with me. I try to make it really worthwhile for everybody and talk about things that I think you're going to have to deal with at some point or another. So, and the nurse, was nervous about it. She's like, will you please see this patient? Will you please see this patient? And she couldn't be there because she had other obligations. I said, yeah, I'll call you right after. And I said, when you're treating the face, you can treat, at these different energy levels. But where are the areas in the face that really are more uncomfortable than others? What are those areas? Can we identify those areas where typically patients complain and kind of at these areas? What's different between this area and this area? Why doesn't this hurt? Why does this hurt? Anybody out there? What's different between this area, hint, and this area? There's no bone here, right? So when you add heat, energy of any sort, radio frequency, laser, ultrasound, whatever it is, there's a sink of fat below the skin. So the fat is an absorber of energy, right? And there are very few nerve endings there. There are very few blood vessels there. It's really a storage area. It's like your closet or your attic, right? You don't really go there very often, and you don't do much. It's a storage area. Occasionally you go there. So when you have an area that has a big sink of fat where you can absorb the energy, it doesn't really hurt very much, right? However, once you start lasering over a bone, what happens, right? There's a very small heat sink there, and the energy passes out, it hits the bone and kind of bounces back, and it really hurts. Believe me, those of you who have done a significant amount of laser know exactly what I'm talking about, right? So it hurts, but you're still okay because you still have a fair amount of soft tissue to absorb that energy. What happens when you start lasering this area? And you're using exactly the same energy that you used here. What do you think happens here? What's going on here? How is this? You hear my pounding? Listen. How is this different than this? What's here? Is it thick? Sid, tell me, what's the difference between the face in terms of the tissue layers and levels and the décolleté, particularly in a woman? Sid, do you have any ideas? Is anyone out there? Can anyone help me? It's thin, Lucy. Right, it's thin. And so the skin is thin, but what's right under the skin? There's less fat. The dermis is thinner, but what's right underneath it? Thin skin, little to no subcutaneous fat. But listen again, I'll give you a hint. What am I hitting? I'm hitting bone, right? So if I'm lasering here, the energy is going through and it's heating up the bone. The décolleté isn't exposed to the sun as much either. Often that's true. But what happens when it is exposed to the sun? It gets damaged tremendously fast because there's no reserve, right? So when we're lasering this area, the energy is going right through that very thin dermis, usually little to no subcutaneous fat, and it's heating the bone. What happens when you heat a bone, right? It holds the heat. So when this patient said, I felt like I was being cooked from the inside out, she was. I saw her today, 4 days later. Her face looked beautiful, slight bit of red. Her face looked like someone took a blowtorch. I'm sorry, her décolleté looked like someone took a blowtorch and scorched her. I mean, it looked like meatloaf. It was like uncooked meatloaf, raw meat. And, it was a mistake because the person doing it didn't understand the difference, right? The areas that are thin, also add in the fact the patient was a woman, she was older, she was thin, she was of Irish ancestry. So you're thinking total setup here, right? The thinner the tissue, the less reserve there is, the less of a sink there is to absorb the energy, the more heat is going to hit the bone. And the more that you heat the bone, it's like then it gradually releases that heat, and you're getting injuries from both sides of the skin. Devastating, tough, really hard. The patient today at day 4 said, finally, I can actually wear clothes, and it doesn't hurt unless I move. I mean, I don't mean to laugh, but it's a pretty painful injury. And again, the same exact energy level was used here as it was used here. And it looked like 100 times, more powerful here. So that just goes to show you that you have to be thoughtful. You have to understand that no matter what you do on the face, you have to really cut it down when you're doing anything along the neck or décolleté, over any bony prominence, over any area where the skin is really thin, where there's no subcutaneous tissue to absorb the energy, right? So that was a huge... Hello, Julia! That was a huge learning point today. And, so I said, when you're treating the décolleté, start at a level that you think is almost too low and explain to the patient, this is just a really sensitive area, and it's an area where you have to be very careful. So let's say you start at a low level, no big deal, right? There's 2 ways of doing it. One is you can do what's called the test spot, which we always used to do in the old days of laser. In the early days when, we were still trying to figure it all out, we would say, come in, and we'll do a little test patch, quarter-sized area, whatever it is, and then come back in a week and we'll see how it's healing. And based upon that test spot, you could determine whether the energy level was just right, too low, or too high, and make the appropriate adjustments, maybe even do another test spot, whatever. Or, like in this particular case I'm suggesting, what you could do is just treat the area. Bay Beauty, Tampa, all the way from Florida. My son just moved to Tampa, loves it there. I don't know if I'm ever seeing him again, if he's ever coming back. I may have to join him down there, but it's a great place. Thanks for joining. So I said, listen, that energy level was X. Go half X on the décolleté and treat the patient. So, see him back. And if that level's okay, or maybe it's a little too low, you can go up again the next time you see them. And maybe for the third treatment, you go up a little more. But you don't ever start at that same level because you end up with that kind of terrible burn that I talked about, right? This is all about understanding the physics of a laser and understanding how to deal with these complications. We would love to have you. Yeah, this is like really one of the first nice days we've had in New England in about 6 months. At least 6 months. I turned the heat off today. Don't tell anyone in my house I did this, but I turned it off because it's like I'm sleeping with the windows open. And they've got the heat on. Like, doesn't make any sense. Anyway, is this something the manufacturer emphasizes or trans? I seriously doubt it, Lucy. This is the kind of thing that you have to learn by listening to someone like me, the mentor, or listening to someone who's done a lot of laser. Julie, I was talking about this patient I saw today whose face was treated with an erbium laser and her chest was treated with an erbium laser. Exactly the same setting. This area looks unbelievably beautiful. This area looks like someone took a blowtorch to her chest. And I was explaining that there's no subcutaneous tissue here to absorb the heat. It's like skin on bone. And so the woman described to me, yeah, really. The woman said to me, before I asked her many questions, she said, I felt like I was being cooked from from the inside out. That's exactly what happened. The energy went down to the bottom. Look, there's no tissue here. Squeeze your own chest and realize how thin that is. And, if it's an older woman who was very thin, who was from Irish extraction, who had sun damage and thinning dermis to begin with, you're basically putting all that energy right onto the bone, and then the bone radiates the heat back to the soft tissue. And a day and a half later, the woman couldn't even put a shirt on. She was in dire pain, and she, was screaming in discomfort. So we took care of it today. Heather, I'm just talking about laser complications that I saw today. You might know about that erbium patient. So it just goes to show you that, when you're over a bony prominence, it's going to hurt more, number one. Even in the face, right? When you're along the jawline and anywhere near the nerves, it hurts like heck because the energy gets sent down to the bone, and, it's just shocking compared to the areas that don't have bone. And when you're treating right on bone, essentially, you got to really lower the level. It just is a terrible thing. So, she's going to be okay. The patient's going to be okay. We took care of her today. We put her on some medication, some measurable dose pack. We put her on some nice skincare products. Fortunately, it was an erbium, right? So it doesn't really penetrate. But this goes to show you that even a laser that's designed just to do superficial work, when done in the wrong place at the wrong energy level, unfortunately, can do a lot of damage, right? So you have to be smart about it and really be well trained. And if you aren't sure if this is the right energy level, just do a test. Do 2 or 3 test spots. Do a low energy, a medium energy, and a high energy, and see them back in a week or two, and say, what, this is the right energy level. I don't, that's what we used to do all the time in the old days, right? Before we really had a mastery and an understanding of laser. It's still a great idea now. Test spots are completely reasonable, and you can show the patient. If some people are afraid to do laser, so let me just do a little spot in the side of your face. And you can see how it heals, and if you want to do the rest of your face, you can. Those are great ways of selling laser, but it's also a good information gathering device for you as a clinician to see whether that energy level is too little, too high, or just right. So any other questions about that before I move on to the next topic? But I just felt like I had to really share that because I guess after doing this for 30 plus years, I just take for granted that you guys know all this, and I'm mistaken to even think that, because there's a lot of people who are just entering the industry now, and these things that I take for granted, like knowing that if you're ever going to laser over a bony, first of all, the number of times we do the neck and décolleté is very small because it's such a treacherous, dangerous area. It's so easy to have complications. Start very, very conservatively and work your way up, and just share with the patient that you're going to start at a conservative level, and then you're going to work it up to the point where you get a more effective treatment. But that's just how it has to be done to be safe. And I don't think anyone's going to yell at you saying, I don't want you to be safe with my face or my body. Just go after it. No one's going to say that. So some of the questions we got were concerning the usual kinds of things. So I wanted to talk about that. I don't want to answer that because I don't want to. I will answer because it's my wife. So I was just joking. So one of the other questions we got was syringe splitting. Like, how do you feel about splitting syringes? Using half a syringe. How do you feel about? Hey Blaze, congratulations on your new promotion. How do you feel about splitting syringes? How do you feel about mixing products? How do you feel about diluting products? And I feel equally terrible about all of those things. I feel like they're really bad ideas, and I think you're only asking for trouble if you do any of those things. Why? Because they're all off-label. The company specifically says not to do these things. And if you have a complication while you've done one of these things that the company's told you not to, how is that defensible? It's not. So why do it? Okay, why split a syringe? So you're only using such a small amount that you can't use a full cc of product? You're welcome. You wouldn't use a whole cc of product. Well, then, you know what? Put it somewhere else, because remember, one of the main reason we get bumps and lumps and issues and infections and all kinds of contamination from injections is people not using sterile techniques. So now you're going to tell me you want to take the product out of one syringe, put it in another syringe, seal it up, and you think that's really a great technique. It's not. Even if you think you're great and you get a little bit of contamination, you get a biofilm, the patient has a nodule, and you have to dissolve the product, you haven't really done anything. And there's no reason to do it. There's always someplace else you can put product. Always somewhere else you can put product. Right? And if a patient can't afford a full syringe, have them come back when they can. Like, don't compromise your values and your standards because the patient can't afford it. If they can't afford it, come back when you can. I mean, honestly, don't do this stuff. And then what are you going to do with the other half syringe that you've got? Where are you going to put it? How are you going to store it? How do you know it's going to get to the right patient? How do you know someone's not going to leave it out? I mean, you don't. So, like, why take chances with your license, with your reputation, with your patient's outcome? Please don't. Why would you mix products? Why would you dilute products? So these companies have spent millions of dollars in many, many years designing products with certain G primes, with certain cohesivities, with certain characteristics that are designed to be used in certain areas. So here you come along, the average injector, and you're going to start your own chemistry game. You're going to start adding fluid or saline or you're adding another product to this product. How do you know what you're doing to that product? How do you know you're not damaging it or destroying it? How do you know if it's going to affect the longevity? How could it possibly help it? How could it possibly extend longevity? So you're taking a product, you're mixing it with saline, you're swishing it around. I believe you're damaging the product. I believe you're voiding the warranty. I believe you're asking for trouble. And that if that patient ever has a problem and they find out that you did something off-label that the company specifically says not to do, I don't want to be your lawyer. I don't know that anyone who would want to defend that case because you've done something that's clearly negligent. So these people who are talking about this, I honestly don't know why. I honestly don't know why. It's never a good idea to do something the company tells you not to, because God forbid you should have a poor outcome. I'm not going to defend you for sure. I'll actually go against you and say that it was a terrible thing to do and you should have known better, because you should. So I was doing a, will we be getting the Juvederm RHA in? RHA is a different company. It's not Juvederm, so I don't know. That's not a real question. It's a different company. It's not Juvederm. It's Revance. And we have it. We've had it for a while. No one's been using it. So what? The next question is. So I was filming something for my school the other day, and two of the people, Blaze is one of them, were there, and we were just talking about Botox, for example, and we were talking about when you should start getting Botox and what age. I said, it's changed. My answer used to be, as soon as you start getting lines at rest, at whatever age that is, when you have lines like this that are there when I'm not trying to animate, that means you need neurotoxin, or else those lines are going to get deeper. And I used to explain to patients, it's like having a piece of paper, and you're kind of just slowly folding it like this, and you let go of the paper, and it's still flat and it's not creased. But if you take your thumb and you get your thumbnail and you crease it, that paper is always creased. You can never get rid of that wrinkle. And I kind of explain it to patients. That's kind of what's happening for example, in your forehead or your glabella. The skin's, folding, and eventually it's getting so deep it's getting creased, and you'll never get rid of that line, even with Botox or any other neurotoxin. So the idea is to sort of stay ahead of it. As soon as you start having lines at rest, you should do it. So the thing that's changed now is that we have new generations of people who don't want to get to the level of having lines at rest. They don't want to look any older. They don't want to age any more than they are right now. So Botox is being used mostly in a preventative way. So people who are in their 20s, and certainly by the time they're 30, but a lot of 20-year-olds are getting treated with neurotoxin even though they have no lines at rest, because they don't even want to get to that point. They don't want to age to the point where they've got them and try to go backwards. That's much harder to do. So I was talking about preventative Botox with them, and they thought it was fascinating. Hey, hello. They thought it was fascinating that this is really what's happening. It's not my idea. It's what's really happening in the world, and I'm sure all of you who treat people with neurotoxins are getting younger and younger people who, like, the first time they notice a wrinkle or a line starting to form, they're in your chair and they're there forever. So that's the difference, right? It's more proactive and preventative. It's all about, it's easier to prevent aging than it is to treat someone who's already aged. It's really hard to bring someone back. And that's what we had to do all the time, because we never had any of these things that we're talking about now. And someone said to me today, it's the 20th anniversary of Botox. Why don't you do a short video about what's happened in those 20 years since Botox was first introduced, because those were kind of the dark ages. And 20 years may seem like a long time to you, or it may not seem like a long time to you, but a lot a lot has happened in those 20 years. It's, this whole space has been completely transformed by all of the new technologies that we use and all of the new things that are happening. So we can actually prevent aging now rather than letting someone get old and try to get young again. Okay, next question. Number 4. So people were asking today about, okay, how do you treat the difficult patient? What makes them difficult? Do they just have expectations that are unrealistic, like a syringe or two of neurotoxin or filler or laser treatment or whatever you do, cool sculpting, whatever it is going to transform them into something that can't be done, right? So we've all had these patients. We all have these patients. We will all see more of these patients because they're coming more and more. They come to us, right? Like a moth seeing a flame. They just or a mosquito. They just go to it. They don't even know why they're there sometimes, but they just feel like they have to be. First thing to do with a patient like that is to assess your own skill level, right? Am I a skilled enough, fill in the blank, injector, laser person, cool sculpting person, whatever it is, to deliver a result to this patient and make them happy? And if you're not sure, the answer is no, you're not. Because I'd rather have you turn that patient away, and I'd rather have you say, I don't think I can make you happy. I think you probably should get other opinions. This is a difficult case. You have a difficult situation. Whatever the terminology you want to use. But the issue is that at first you have to identify them, right? So if someone starts talking about how all their other providers prior to you were terrible and I'm sure you're going to be amazing, that's a big red flag, because you're going to be the next one who gets the 1-star Google review and, on and on. So be careful. If you start getting that feeling, assess them carefully. Ask a lot of questions. Ask about what their real concerns are. Ask about what their expectations are. Ask what kind of result they're thinking they want. How much improvement are they looking for? These are all questions that I ask. And then say, okay, so you're looking for that kind of improvement. What are you willing to do? You're willing to do surgery? Are you willing to do this? Are you willing to do that? And they just want, a world's worth of improvement with one syringe of filler. So right away, you've got a problem, right? You've got a level of expectation that can never be met with the treatment that you're planning to do or are able to do. So you have to be, with these kinds of patients, honestly, you have to be 100% honest about it. There have been many times when I've seen patients and I've thought to myself, I might be able to make them happy, but there's so much negativity around this patient. There's so much pressure on me right now. There's so much negative things that have happened to this patient. Do I want to take that risk? So I have to look deep into my own soul and say, I want to help everybody, right? I think we all do. That's why we're doing this. And even if I can help this patient, even if I think I have done a great job, will they agree? Well, is this person capable of being made happy? If those questions are starting to percolate through your brain, you got to trust that. You got to trust that feeling you're getting. And there have been times where I've just, walked out of there when I have a code with the person at the front desk, and usually she comes in and she gives the person the estimate at the time of the consultation. But if I say, the person at the front desk is going to email you the quote, that's a way of saying to my front desk, we're not doing this patient. We're not taking care of this patient. We don't want them in the practice. And, for a variety of reasons, we have this whole list in our back, the back of our office. These are all the kinds of things we don't ever want to do. These are the kind of traits that patient had we don't ever want to see again. So it's a little bit of a joke, but it's really based on true stories where we've had patients who were just nightmarish. So, I'd rather have the patient not do the surgery or the treatment with me or my staff and not be disappointed and go to someone else and give them a 1-star Google review or whatever they want to do. But I wrestle with that. We all wrestle with it because we all feel like we could help people. But sometimes we have to recognize the fact that we can't help them, they can't be helped. They won't accept the fact that they're better or they've been helped. I mean, there's been so many times where I've been thrilled with a patient's result, and they're like, I don't see the difference. I mean, really, you don't see like how much better this is? No, I don't. I don't see anything. Thank God we have photographs for everything, and even when you show them the photo, I mean, it's bringing back a PTSD for me, because it's happened. So, unfortunately, you have to recognize the fact that there's going to be a certain percentage of people that you probably shouldn't treat. Either your skill level isn't high enough, you don't have the right personality for it, the patient will never be made happy, you're not a good match, like you just don't get along, like anything else in life, right? There are things that go well and things don't. So when the little hairs on your neck start to go up and you feel like, this patient may not be right for this treatment, honestly, don't do it. I mean, some of the best things I've ever done have been not operating on certain people or not treating certain people and thinking, my God, that was close. I almost did that. And there have been plenty of times where I wish I hadn't operated on people. I'm like, geez, this is really a difficult situation. So when you're doing these injections, when you're doing your assessment, really dig into the psychology if you can. If you feel like there's any little bit of red flag there, if they've had an extensive past medical history, if they've sued other providers before, if they've said bad things about other providers, if they've written bad reviews, it's just not necessarily going to go well, and it's a very high-risk situation for you, and I don't want you guys to get into any trouble. I want you guys to sort of walk through this minefield, well, and avoid those landmines. And I think, one other thing, and just try to figure out what their real motive is for being there today. Like, are they trying to, get a new husband after a divorce? Are they trying to become a movie star at the age of 60? Are they trying to look 25 when they're 70? Just try to figure out what's gotten them there, right? Because, most of the patients we treat are great, nice people, love them, wonderful, like long-term relationships, kind of what you want in a practice. What do you say to a difficult patient that wants to book a second appointment with you, but you're uncomfortable with treating them again? I would just say, I don't think we're a good match. I just don't think that, that we're going to work well together, and I think you should, see someone else. Keep it positive, never say anything negative about them or to them, just that this isn't a good match, or you don't feel like you can, kind of get to the point that you're going to make them happy. Just be honest about it. Our anesthetics, my goodness. Just be honest about it, and I know, we met before, and I've just been thinking about it, and I just don't think we're a good match, and I think you might be better off with another provider. And that's a nice way to do it. That's a nice thing to say, and you're being honest about it. If you've had a negative experience with that patient on your first meeting, it's only going to get worse from there, right? It's probably only going to get worse. So don't be embarrassed to say that, and you'll sleep better at night. You'll be happier as a person. Because some of these patients can really make it difficult to enjoy your life. And we all know what we're talking about. So any other questions before we sign off? It's been a fun night. Thank you all for taking the time out of your Tuesday night to join me. I am the Aesthetic Mentor. Check out the link in our bio if you want to train with us. I'm here every Tuesday night for you, keeping you safe, keeping your patients safe, and making the world of aesthetics a better place to be. Have a good night. I'll see you guys next week.